Hello everyone, I am Dr. Sandesh Prabhu, cardiologist and electrophysiologist practicing at Manipal Hospital, Bangalore. Today I will be talking about a cardiac condition called heart failure. Heart failure is a common clinical condition what we see in our day-to-day clinical practice. As we all know, heart is a specialized muscle, the basic function of which is to receive the blood from the whole of the body and to pump the blood to the all parts of the body. Whenever heart fails to work effectively, whenever the heart fails to pump effectively or fails to receive the blood effectively, the condition results in heart failure. So some of these patients can have both the conditions together. The most common cause of heart failure is maybe previous heart attack or maybe ongoing heart attack, pre-existing coronary artery disease, that is blockages in the arteries which supply blood flow to the heart. Some of the patients can have valvular pathologies like heart valves, if they are not opening completely, that is called valvular stenosis, or valves are not closing completely, which is called valvular regurgitation, resulting in leakage of the valves. These also can lead to heart failure. Some conditions like arrhythmias, wherein there is a heart rhythm disturbances, that also can lead to heart failure. Most common symptom the heart failure patient will give will be shortness of breath. The shortness of breath will be seen on minimal exertion kind of thing. As the stage progresses, as the time progresses, the shortness of breath can be seen even at rest. The patient can have a symptom of fatigue. Some of them will not be able to lie down flat on the bed, and some of them can have might have a symptom like getting up in the middle of the night because with the panting kind of thing. So these are all the symptoms of heart failure. Since the heart is not pumping effectively, there will be fluid accumulation in the body, resulting in swelling of the lower limb, swelling of the abdomen, and swelling can be seen in the face as well. Heart failure is a clinical diagnosis, and it is diagnosed based on the signs and symptoms. Some basic tests would be required to to look at the etiology of the heart failure. We do ECG, 2D echo and chest X-ray. Echocardiography or 2D echo can give us a lot of information. It will tell us about the functioning of the heart. We'll get to know pumping of the heart by a measurement called ejection fraction. We'll get to know the valve functioning, if there is any valve leakage or those things, and if there is any hole in the heart. A lot of information we get through the echocardiography. Some patients would require some basic tests, blood tests would be done to see the other etiologies, and if something is detected on these blood tests, that needs to be corrected. Heart failure patient needs immediate treatment. We start with medications. There are other group of medications which will be started in the heart failure patients. And once the patient is stabilized, we try to look for the cause of etiology of the heart failure, and that needs to be addressed as well. Some patients might require coronary angiography, on which if we find blockages are detected, that would require to be addressed as per the number of blockages, percentage of blockage, and location of the blockages. Some might require angioplasty, and some other patients might require bypass surgery. If rhythm disturbances are responsible, we need to start some medications, and those who are not responding to this might require something called EP study, radio frequency ablation. We try to where we try to locate the origin of the arrhythmias, and we treat accordingly. If valve problems are detected, some of them would require valve repair or valve replacement based on the severity of the problem. Some of the patients who do not respond to these treatment might require advanced therapies like device therapy. In device therapy, we implant them with specialized devices called cardiac resynchronization therapy, CRT, or cardiac resynchronization therapy defibrillator, CRTD, which can help in these kind of heart failure patients, and it gives a symptomatic relief to them. Advanced heart failure patients who do not respond to these kind of treatment or are not candidates for this kind of treatment, we offer them with a heart transplantation. Yes, we can prevent heart failure. There are various stages of heart failure. If the risk factors for heart failure are detected early and treated accordingly, heart failure can be prevented. Conditions like blood pressure, diabetes mellitus need to be kept under control. Smoking has to be stopped completely. Tobacco usage in any form is not good for the heart, and alcohol consumption should be reduced as much as possible. If the risk factors for the heart failure are detected early and treated promptly, heart failure can be prevented. Thank you.